Gabapentin use linked to increased dementia risk. What you need to know. Imagine a scenario where a commonly prescribed medication, once thought to be relatively safe, might come with significant risks, specifically, increased chances of dementia and cognitive impairment. This is precisely what a recent study published in Regional Anesthesia and Pain Medicine has uncovered about gabapentin, a drug frequently used for treating chronic pain. The study, which analyzed electronic health records from 68 healthcare organizations across the United States, found that receiving 6 or more prescriptions of gabapentin for chronic low back pain was associated with a 29% higher risk of developing dementia and an 85% higher risk of mild cognitive impairment, MCI, within a decade. But here's where it gets even more concerning. These risks were more than twice as high in individuals typically considered too young to experience such conditions, those aged 18 to 64. Unlike opioids, gabapentin is known for its relatively low addictive potential, making it a popular choice for managing chronic pain, particularly neuropathic pain. Its neuroprotective properties have made it a favored option for many healthcare providers. However, recent findings are raising alarm bells about potential side effects, including a possible link to neurodegeneration. The research community is still grappling with mixed results, especially regarding which age groups might be most vulnerable. To delve deeper into these concerns, researchers utilized real-time data from TrinetX, a comprehensive health research network. They examined anonymized records of over 26,000 adult patients who had and hadn't been prescribed gabapentin for chronic low back pain between 2004 and 2024. By controlling for various factors such as demographics, coexisting conditions, and the use of other pain medications, the team uncovered some alarming trends. Among those who received 6 or more gabapentin prescriptions, the likelihood of being diagnosed with dementia increased by 29%, while the risk of MCI jumped by 85% within 10 years of their initial pain diagnosis. When the data was broken down by age, the findings revealed that individuals aged 18 to 64 who were prescribed gabapentin faced more than double the risk of developing either condition compared to those who did not receive the medication. Interestingly, the study also noted varying levels of risk within different age subgroups. While there was no heightened risk among those aged 18 to 34, the dangers escalated significantly for individuals aged 35 to 49 and 50 to 64. Specifically, the risk of dementia more than doubled, and the risk of MCI more than tripled for these middle-aged groups. Furthermore, the frequency of prescriptions correlated with the risk. Patients with 12 or more prescriptions had a 40% higher chance of developing dementia and a 65% higher chance of developing MCI compared to those prescribed gabapentin between 3 and 11 times. It's crucial to emphasize that this study is observational, meaning it identifies associations rather than proving causation. The researchers acknowledged that their study was retrospective, and they couldn't account for factors such as the specific doses of gabapentin used or the duration of treatment. Nonetheless, their findings underscore the importance of closely monitoring patients prescribed gabapentin for signs of cognitive decline. As we navigate these findings, it's essential to consider the broader implications. For example, this research could influence clinical guidelines and patient education strategies. It also highlights the ongoing need for comprehensive studies to better understand the long-term effects of gabapentin, particularly in younger populations. So, what does this mean for you? If you or someone you know is taking gabapentin, it's important to discuss these findings with a healthcare provider. They can offer personalized advice and monitor for any signs of cognitive changes. And this is the part most people miss. While gabapentin may provide relief for chronic pain, it's crucial to weigh the benefits against potential risks. What do you think about these findings? Should gabapentin usage guidelines be revised based on this study? Share your thoughts in the comments below. Does gabapentin increase dementia risk? Study reveals shocking findings. Could gabapentin be a hidden risk for dementia? The anticonvulsant medication gabapentin, often used for conditions like epilepsy and neuropathic pain, has recently come under scrutiny for its potential link to an elevated risk of mild cognitive impairment, MCI, and dementia. However, not all experts are ready to jump to conclusions based on the current study findings. After meticulously adjusting for factors such as age, existing health conditions, and the use of other pain relief medications, researchers discovered that adults prescribed gabapentin for chronic low back pain faced a 29% higher risk of developing dementia and an astonishing 85% higher risk of MCI over a decade, compared to those who managed their back pain without this drug. This groundbreaking discovery lays the groundwork for further exploration into whether gabapentin might play a direct role in the onset of dementia and cognitive decline, according to the research team led by Nafiz Egrari from Case Western Reserve University School of Medicine in Cleveland, Ohio. In the interim, the team emphasizes the importance of closely monitoring patients on gabapentin for any signs of cognitive deterioration. The study was published online on July 10 in the journal Regional Anesthesia and Pain Management. The unseen cognitive toll of pain relief. Gabapentin has gained popularity as a safer alternative to opioids for chronic pain management, thanks to its lower potential for abuse. However, its connection to cognitive decline and dementia remains shrouded in mystery. To delve deeper, Egrari and his colleagues tapped into the TriNetX national database, analyzing a vast pool of de-identified patient records to create a matched cohort of 26,416 gabapentin users and an equal number of non-users. Their initial analysis revealed that adults aged 18 and older prescribed gabapentin had a higher likelihood of being diagnosed with dementia, risk ratio R 1.29, and MCI R 1.85. To understand age-related nuances, the researchers divided the cohort into elderly 65 years and older and non-elderly 18 to 64 years groups. In the elderly group, gabapentin use was linked to increased rates of both dementia R 1.28 and MCI R 1.53. Similarly, non-elderly users also showed higher incidences of dementia R 2.10 and MCI R 2.50 compared to non-users. Drilling down further, the non-elderly group was segmented into narrower age brackets, 18 to 34, 35 to 49, and 50 to 64 years. Interestingly, among the youngest group, 18 to 34, there was no significant difference in dementia or MCI rates between gabapentin users and non-users. However, the picture changed dramatically for those aged 35 to 49, where gabapentin prescription was associated with a significantly higher risk of dementia, R 2.44, and MCI R 3.50. A similar trend was observed in the 50 to 64 age group, with elevated risks of dementia R 2.28 and MCI R 2.22. Moreover, the frequency of prescriptions played a role. Patients with 12 or more gabapentin prescriptions faced a higher risk of dementia R 1.40 and MCI R 1.65 compared to those with fewer prescriptions, 3 to 11 times. A word of caution. Several esteemed experts weighed in on the study through a statement from the UK's Science Media Centre. Martin Prince, a professor of epidemiological psychiatry at King's College London, warned that confounding factors and reverse causality could be plausible explanations for the observed effects. Tara Spires-Jones, director of the Centre for Discovery Brain Sciences at the University of Edinburgh, pointed out that while the authors employed statistical methods to account for other risk factors, this study design cannot definitively prove that. Gabapentin risks. New study unveils dementia and cognitive impairment concerns. #### New insights into the risks associated with gabapentin. Gabapentin prescriptions for chronic back pain may pose significant risks, particularly concerning dementia and cognitive decline. This alarming connection has been highlighted in a recent study, which raises important questions about the safety of gabapentin, especially as its off-label use continues to rise. Gabapentin, commonly known by its brand name Neurontin, has been linked to an increased likelihood of developing dementia and experiencing cognitive impairment among individuals suffering from chronic low back pain. This conclusion stems from an analysis of healthcare claims data in the United States, which examined over 52,000 adults over a decade. The findings revealed that patients who received 6 or more prescriptions for gabapentin exhibited a higher incidence of dementia, with a risk ratio, R, of 1.29, 95% CI 1.18 to 1.40, and a significantly elevated risk of mild cognitive impairment, R 1.85, 95% CI 1.63 to 2.10, compared to those who were not prescribed the medication. Dr. Chong Kim from Metro Health Medical Center in Cleveland, Ohio, along with his co-authors, emphasized that the frequency of prescriptions directly correlates with these risks. For instance, individuals with 12 or more prescriptions had an even greater risk of dementia, R 1.40, 95% CI 1.25 to 1.57, and mild cognitive impairment, R 1.65, 95% CI 1.42 to 1.91, compared to those who received gabapentin between 3 to 11 times. Among younger patients aged 18 to 64, the risks were particularly pronounced. Those prescribed gabapentin were found to have more than double the risk of developing dementia, R 2.10, 95% CI 1.75 to 2.51, and mild cognitive impairment, R 2.50, 95% CI 2.04 to 3.05, compared to their peers who did not receive the drug. Interestingly, while there was no increased risk for those aged 18 to 34, the risk for dementia more than doubled and the risk for mild cognitive impairment tripled for individuals aged 35 to 49. A similar trend was observed in the 50 to 64 age group. For older adults aged 65 and above, the data indicated a heightened incidence of both dementia, R 1.28, 95% CI 1.15 to 1.42, and mild cognitive impairment, R 1.53, 95% CI 1.28 to 1.83, among those taking gabapentin. Dr. Kim pointed out that these findings should prompt healthcare providers to carefully consider the implications of prescribing gabapentin, especially given its increasing off-label use. He stressed the importance of ongoing evaluation of the drug's efficacy and potential risks. However, it is crucial to note that the study has its limitations. Dr. Kim acknowledged that further research is necessary to confirm these findings and to better understand the relationship between gabapentin and cognitive decline. Gabapentin is primarily approved for treating seizures and postherpetic neuralgia, while gabapentin enacarbil is indicated for restless leg syndrome. Despite these limited approvals, gabapentin and its related medication, pregabalin, Lyrica, are frequently prescribed for various pain conditions without sufficient evidence of their long-term safety. Common side effects associated with gabapentinoids include drowsiness, dizziness, blurred vision, and difficulties with coordination and concentration. In 2019, the FDA issued warnings regarding serious respiratory issues that could arise in patients using gabapentin or pregabalin, particularly those with existing respiratory risk factors, such as concurrent opioid use or chronic obstructive pulmonary disease (COPD). Dr. Kim and his colleagues noted that while existing literature has identified several risks associated with gabapentin, there remains a lack of comprehensive understanding regarding its impact on cognitive function and its potential role in neurodegenerative processes. Leah Merceline, PhD, from Alzheimer's Research UK, who was not involved in the study, remarked that while the current research provides intriguing insights, it does not establish a definitive link between pain medications and increased dementia risk. She cautioned that the study's focus on chronic pain patients means other influencing factors cannot be ruled out, and previous studies on gabapentin for conditions like seizures have not shown a similar association with dementia. The researchers utilized the TrinetX national database, analyzing patient records from 2004 to 2024, specifically focusing on adults with chronic low back pain over a 10-year follow-up period. Individuals with prior gabapentin use, dementia, epilepsy, stroke, or cancer were excluded from the analysis. The study employed propensity score matching to account for demographic variables, medical diagnoses related to cognitive decline, and other pain medications, resulting in two balanced groups of 26,416 patients each. Both groups had a mean age of approximately 53 years, with around 58% being female and 73% white. Notably, about 65% of patients in both groups received opioid prescriptions, while 39% were prescribed benzodiazepines, and 29% received skeletal muscle relaxants. Comorbidities such as hypertension, diabetes, and sleep disorders were comparable across both groups. As an observational study, the researchers acknowledged that causal conclusions could not be drawn, and potential miscoding in electronic medical records could have influenced the results. Additionally, neither the dosage nor the duration of gabapentin use was controlled for in the analysis. The researchers concluded that their findings underscore the necessity for vigilant monitoring of adult patients prescribed gabapentin to identify any signs of cognitive decline. They expressed hope that this study would encourage further investigation into whether gabapentin may play a causal role in the development of dementia and the mechanisms underlying this relationship. ***, what are your thoughts on the implications of these findings? Do you believe that the potential risks of gabapentin outweigh its benefits for chronic pain management? ***.